Morning! Nag-coffee ka na? Kasi today we're gonna talk about COVID vaccines. I know that you have a lot of questions on the vaccine, kung effective pa ba ito, and with the Delta variant that's here in the Philippines now, marami pa ring tanong, and we also know that the cases in our country is rising, and we hear cases of COVID even among the vaccinated, diba? So, ang tanong ngayon, effective ba talaga yung vaccine? Okay, so I am Lottie. I'm a medical doctor based here sa Philippines, and it's my pleasure to share with you the things that I have learned regarding COVID vaccine. So for today, we will answer one question lang muna on the COVID vaccine, and that's the question on the effectiveness. And I think the best way to approach this is to look back at the studies done on the vaccines, the original studies, and analyze this study so that we can have our own conclusions, diba? Okay, so we have to remember that vaccine efficacy rate and vaccine effectiveness rate are both technical terms, but they actually mean the same thing. It is the percentage reduction in your risk of getting COVID after you get vaccinated. The only difference is in how we calculate them. So vaccine efficacy rate, these are coming from clinical trials. Vaccine effectiveness rate are from real-world data. Ang clinical trial kasi, we enroll participants very intentionally and selectively. Healthy yan, walang comorbidities, walang bata, walang matanda, elderly, or walang buntis. Ang real-world data naman, on the other hand, is when we have already vaccinated the population. And then we monitor them and take the data from there and calculate the effectiveness of the vaccine from there. Okay. Now, let's take a look at the Pfizer vaccine clinical trial, no? And let's simplify it. Ang kailangan lang natin doon para maintindihan yung clinical trial na yun, yung mga technical studies na yun, ay ito. This is a 2x2 table that is commonly used para masimplify, para actually maintindihan natin yung mga pangyayari sa mga bagay-bagay sa mundo. Ginagamit yan ng mga experts natin, mga epidemiologists, ng mga scientists. And we will be using it today. So, first off, we have to label this table. Dapat malinaw para hindi tayo magkagulo pag naglagay na tayo ng mga values dyan. Huwag nating itulad sa love life mo na malabo. Nakalimutan mo kasi lagyan ng label. Okay? Yan. So, sa first row, ilalagay natin dito yung mga may bakuna. Sa first row, dito yung may bakuna. Tapos, sa second row, dito natin ilalagay yung walang bakuna. Ayan. Ayan. So, first row, may bakuna. Second row, walang bakuna. Ngayon, dito naman sa column na to, sa first column, dito natin ilalagay yung may COVID or nagka-COVID. So, gawin na lang natin may COVID, positive COVID. Tapos, sa second column, ilalagay natin yung negative COVID. Ayan. So, nagka-COVID, hindi nagka-COVID. Ngayon, yung values na kailangan natin dito, makikita natin dun sa study ng Pfizer. Sa kanilang pag-aaral, yung mga nagka-COVID sa mga nabakunahan ay 8. 8. Yan, 8. Tapos, yung mga nagka-COVID naman sa mga walang bakuna ay 162. So, ilalagay natin dito, 162. Ayan. So, titignan naman natin ngayon yung hindi nagka-COVID. Dito sa mga may bakuna, ang hindi nagka-COVID ay nasa 21,822. Tapos, yung hindi nagka-COVID sa mga walang bakuna, nasa 21,668. Ayan. Yan lang yung kailangan natin actually para maintindihan yung clinical trial. So, kung gusto mong makuha yung percentage ng mga nagka-COVID sa mga nabakunahan, simple lang yan. 8 divided by the total nito, which is 21,830, and you get a percentage rate of 0.04%. Ayan. So, sa mga nabakunahan yan na nagka-COVID, yung mga hindi naman nabakunahan na nagka-COVID, ito naman yan, 162 divided by the total, 21,830, and we get 0.74%. Ayan. So, yung risk for infection or your chances for infection nag ng mga nabakunahan is 0.04%. Compared mo dun sa risk or chances for infection ng mga hindi nabakunahan, which is 0.74%. Malaki yung difference din actually. And if we compute for the difference nung 0.74 tsaka 0.04%, that is actually what we call the vaccine efficacy rate. And to compute for that, simple lang yan. 0.04, etong 0.04 divided by this 0.74%, and we get a value of 0.05, and we subtract that from 1, which is the perfect number, constant perfect number, and we get 0.95 and multiply that by 100% to get the 95% efficacy rate ng vaccine ng Pfizer. So that's where the 95% is coming from. It's the laki ng difference ng 0.74 sa 0.04%. So, yan yung efficacy rate. Ano naman ngayon yung ibig sabihin niya sa buhay mo, no? Gawin natin personal. For example, say you have diabetes, hypertension, asthmatic, or whatever. So, yung initial risk mo for infection was actually, for COVID infection, was actually, say, 15%. Kunyari, nasa 15% yung chances mo for infection nung hindi ka pa nababakunahan. Ngayong nagpabakuna ka at Pfizer yung binigay sa'yo. So from 15%, after you get vaccinated with 95% efficacy ng Pfizer, your risk now or chances for getting COVID is actually lowered. Mababa. Sobrang baba niya actually. So 95% of 15%, that's 0.1425. Iles natin sa 15 and we get 0.75%. So your new chances for infection is actually 0.75% if you get the Pfizer vaccine. Okay? So ang laki ng difference, 'di ba? Sobrang laki ng difference kung i-apply natin actually sa real world. Di sabi naman ng iba, wow, paano naman kami 60%, 70% o kaya 80%? Sige, tignan natin. So kung binigyan ka naman ng 60% efficacy na vaccine, ang ibababa naman niya, i-compute mo lang siya. It's 60%. 60% ng 15% is 6. And you less that sa 15, and then you get 6. So your new risk for infection is actually 6% na lang. So from 15%, nagpa-Sinovac ka, 6% na lang yung risk mo or yung chances mo for infection ng COVID. Amazing, di ba? Ang laki ng difference. So that's why we are saying that the vaccines are actually effective regardless sa kanilang reported na vaccine efficacy rate. Kasi they lower your risk for infection. Kumpara kasi dun sa iniisip natin, like sa Sinovac, ang iniisip kasi natin dati, di ba? Paano pag nasa 40% ka na hindi tinalaban ng vaccine, di ba? Ang laki nun. So, that's not actually what it means. Ang ibig sabihin nun, so di ba, yung 40% na iniisip mo, 6% lang pala yung chance mo na magka-COVID. So that's how the vaccine efficacy rate is actually interpreted. Mas madali lang siya, di ba? Simple lang. And I really hope that this session was able to give you a better understanding of what it is all about, how to apply it to your lives, and how it will help guide you in deciding for your health and for your well-being. Okay?